First challenge is one that all of us who work in the rare disease space deal with, which is just the rareness and people not being aware of how important these diseases are and how they impact my patients and their families' lives. Certainly, when you think about all rare diseases, it represents millions and millions of people, but an individual rare disease is called that for a reason, and it's a challenge just to get the word out and have folks, particularly people, creative people in the technology fields, thinking about our patients and how they can benefit them.
One of the most pressing challenges that we face kind of is in the area of diagnosing the disorders that we treat. In nephrology, and especially in the area of glomerular disease, we need tissue to diagnose patients with their specific diseases, right? We don't have the ability to make a specific diagnosis without doing a kidney biopsy. And even then, we need better tissue biomarkers and non-invasive serum, urine, and imaging modalities that will enable us to give better prognostic information to our patients.
We encounter a lot of challenges in rare diseases, the first of which is that there are really no established treatments. So we work really hard to develop new treatments, but in doing so, we try to figure out how best to measure different clinical symptoms. So that ends up being one of the biggest challenges, because many of the rare diseases that we work with, the kids are severely developmentally disabled and they can't really answer questions directly, and you can't get a very good sense of how they're feeling, or if you're providing an intervention, even whether they're doing better in the context of that treatment.
So there's two things. I think the first, for research, personally, I think it's very difficult to capture accurate quality of life information from patients. You know, every time you're seeing them in clinic, you're getting just a snapshot of what you're hearing then, and you're asking your targeted medical questions. So you're really not getting the full picture of what is it like for them at home, day to day, what are they really struggling with, and how can the medical team help with that. And then also, kind of more on the clinical aspect of things is, because these diseases are so rare, a lot of times patients are just not physically able to come to specialists. A lot of patients travel really significant distances across states to come see us, and then they're coming to see us once because that's their capability. You know, they want to see a specialist, but what we would recommend is, you know, maybe come see us every 6 months, every 1 year, and they just physically can't do that.
The biggest problem we've discovered that we have is that there are patients all over the country, but really all over the world, and they have trouble getting to the right expertise that understands this relatively rare problem that they have. The parents sort of become experts, but they're of course not real medical experts, and the medical experts they're seeing, or the medical people they're seeing, don't necessarily have the right expertise for these disorders, and there are nuances that are specific to it where those of us, few that we are, that know about it would certainly be helpful.
So because carcinoid and neuroendocrine tumors are so rare, our pressing problem is really that because we don't see that many patients with these diseases, that we have just smaller numbers when it comes to testing therapeutics, when it comes to having sort of the information that you would have with any more common cancer like breast cancer or colon cancer. It just takes a lot longer for us to develop not just the therapeutics, but also just to get the numbers that we need for any type of clinical trial or for any type of research. So just to give you an example, you know, until I would say about 10 years ago, we didn't have a uniform way of staging cancers, carcinoid cancers, and this is something that's a very basic step for any cancer, breast, lung, or colon cancer. But for us, we didn't have a uniform way that we staged it, and therefore we didn't even have the right vocabulary or tools to be able to communicate with other people who took care of patients with these tumors. And so even if when such a basic thing like staging is missing, you can imagine that the other types of things such as just the basic science, our understanding of the clinical complications, and our understanding of what happens clinically, those are all much more limited because the cancer is rare.